everyone, I am Dr. Charu Modi, consultant obstetrician and gynecologist, and today I am going to tell you about uterine balloon tamponade, a technique used in cases of postpartum hemorrhage to arrest the bleeding when other measures like uterotonics, prostaglandins, tranexamic acid, etc. fail to control the bleeding. This technique, which I am going to demonstrate today, has been developed by Professor Nalini Mishra of Chhattisgarh, and that's how it got its name as CG uterine balloon tamponade. Before insertion of this uterine balloon tamponade, there are certain prerequisites. We have to make sure that the uterine cavity is empty. It should not contain any placental tissue. We have to perform uterine massage, rule out uterine rupture, uterine infection or uterine malformations, plus allergy to latex and silicone have to be ruled out. Moreover, there should not be any perineal tear as a cause of postpartum hemorrhage. The things we require to make this CG uterine balloon are here. I am going to demonstrate to you. We need a Foley's catheter, preferably number 20 or 22, sterile gloves, then a bottle of normal saline, sponge holding faucet, scissor, 50 cc syringe, disposable syringe, and condom plus a beaker. Take Foley's catheter number 22 and push some air inside to inflate the balloon. Now catch hold of this balloon and with the help of a scissor just cut it. Now this loose part, the part you have cut, this balloon, now just cut it all over. Go on cutting it all over. I am going to show you. I have made one cut Foley's and have kept it here. Just invert this margin and make it like this. Now the other end, this port, will be used to make two rings. Two rings like rubber bands will be made by this end. Just cut it. One ring, and likewise you make the other ring also. These two rings I have already made and kept. Now take this condom and slide it over the catheter like this, so that it covers the entire length like this. Now take one ring and on this exposed part just tie it. Care should be taken not to tie it vigorously. Just make two loops. Then come down and tie a rubber band of this here also. This is how you make it. Then after you've tied both the knots, take the scissor and cut the upper part of the catheter. Where you can see this hole, just below it, cut the catheter. So that you can see this hole now. One end has been tied here, the other is here. As you can see this hole inside, it has got an advantage that you can measure the amount of blood which is draining from this port. After draping the vagina with the betadine solution, you catch hold of the anterior lip of cervix with the valsalum, and with this catheter between your two fingers. Try to push it inside the uterine cavity. After you've pushed the catheter inside the uterine cavity, with the help of this end, go on pushing normal saline till the balloon inflates. As you can see, I have done it here. So push around 200 to 400 ml of normal saline as per the need. The balloon will go on inflating, thereby occupying the whole uterine cavity, thus arresting the bleeding vessels. And you can see there is no leakage as well. After you've inflated the balloon, connect the urobag with this end and pack the vagina and see for any blood drainage. CG uterine balloon tamponade has the advantage of central drainage lumen for assessing blood loss in real time, which allows for early corrective actions. This CG balloon is also cheaper and more consistent than the conventional condom balloon tamponade because it doesn't use suture materials. The other advantage of this balloon tamponade is that it reduces the need for surgical interventions and blood transfusion and prevents unnecessary hysterectomies and disabilities in women. It has to be left in situ for around 12 to 24 hours, and once there is no collection in the urobag, you are sure that the bleeding has been arrested, you have to remove the fluid slowly. Around 15 to 20 ml or say 50 ml of fluid is gradually withdrawn and monitor for bleeding. If bleeding starts again, refill the balloon. Otherwise, deflate the balloon with 50 ml at regular intervals, say every 30 minutes or 1 hour. And continue to monitor the woman for the next 6 hours once the balloon is deflated and is taken out of the uterine cavity. This indigenous uterine balloon tamponade device is very good in cases of postpartum hemorrhage to arrest the bleeding in low resource settings like us. I hope this video demonstration proves to be useful. Thank you very much.